All right. Good afternoon, everyone. We're going to go ahead and get started. We are after 2 o'clock. So thank you for joining us for the Shelter Diversion for Service Providers. This is session 1. We will be having a follow-up session in a few weeks. So look out for that date. It will be going out in our newsletter or in separate training emails. So I am Amber Freeman. I am the Interim Director of Training, Technical Assistance, and Community Impact at CCH. And I am joined by some of my team members, Bobby Riddick, who is a Community Impact and Equity Program Manager, as well as Catherine Whitney, who is our Community Impact Program Manager. So today we're just going to give, I see we have folks that might be joining us for the first time. So, and I'm going to mute some people. 1 second. So we're going to go over just a quick overview of the Connecticut Coalition to End Homelessness and what our role is, as well as the CAN system. I'm going to spend a good amount of time talking about the basics of shelter diversion, which is really why we are doing this training. We see that there's a lot of different interpretation of what shelter diversion really is. So we're going to really speak to that and provide some examples, leave some space to have some discussion about diversion. I'm going to talk about resource mapping, which is a really important component of diversion, talk about our emergency assistance, and then the next steps when diversion isn't possible. Lastly, we'll open it up for some Q&A. So just quick high level about the Connecticut Coalition to End Homelessness. So who we are, we're an organization that was founded in about 1982 to really provide a voice for nonprofit organizations, faith-based groups, and municipal governments that's really responding to the then emerging crisis of homelessness. So overall, we are the leading statewide organization that supports the efforts to end homelessness in Connecticut. So our mission, overall, our collective mission is to prevent and end homelessness in Connecticut. It's really simple, says it right in our name. And our vision is to have a statewide system that is capable of ensuring that homelessness is rare, brief, and non-recurring. That's something that you would always hear amongst our sector. You know, we don't want anyone to experience homelessness, so we want it to be rare. If they do experience homelessness, as shortly as possible, and non-recurring, meaning only one time, right? We don't want someone having repeated episodes of homelessness. So our roles at CCH, and I will quickly go over them. Our first role is data and analysis. So we administer our statewide administrative data system on homelessness, HMIS, which I'm sure you all are familiar with. And we use it to conduct data analysis and research to inform and influence practice, policy, and funding decisions related to ending homelessness. Second, we have training and TA, which we're doing today, where we work with providers and other community organizations to help them really with building capacity, sharing, learning, and implementing best practices. We also work amongst advocacy, where we're educating elected officials, the public, other partners about what the problem is, possible solutions, and resources that we really need to end homelessness. We also have community impact, where we strengthen local collaboration, create and support adherence to policies, procedures, provide staff support, and community quality. And I'm sorry, I'm going down my list trying to find who I need to mute. So if it is you, can you please mute yourself? Thank you. And lastly, we have emergency assistance, where we raise money to fill the gaps in emergency resources that frontline workers can access to help the clients. So as we're always talking about our homeless response system, and those that are new to this, you always hear the acronym CAN, right? So we work off of a CAN in Connecticut, which stands for our Coordinated Access Network. The CAN is broken down into 7 regions, and you can see from the picture, they're color coordinated. So we have 7 different CANs. We have a Fairfield CAN, Greater New Haven CAN, a Meriden, Middlesex, Wallingford, Waterbury, Litchfield CAN, Central Connecticut CAN, which is really small, works really closely with Greater Hartford CAN, and then we have the Eastern CAN. So the CAN system works together, different homeless service providers, shelters, housing providers, homeless outreach, different organizations all together form the CAN. And within each CAN region, the different providers really coordinate to divert households from entering the shelter. They manage their access to shelter, conduct homeless outreach. They match individuals to various housing vacancies. And then if you all would like to see additional information on individual CAN performance, we have the link that you can go to on CCH's website. So our system, our homeless response system, there's a lot for this diagram. So basically, this is a high-level diagram, which outlines the process for coordinated access, right? So when someone is in need, they can access our system in 2 ways. But actually, we are working on additional ways so that providers can access the system and do not have to go through the process of 211. However, for now, if there is a household that's in need, someone can call, they'll call 211. When they call 211, they'll take their additional information, demographics, get an understanding of what type of service they need, what type of assistance they need. They're then sent over to a CAN where they'll have a CAN assessment. At that CAN assessment, they will have a conversation, really try to find out what type of service an individual is looking for, what their housing situation is, what resources they may need, what their family demographic consists of, income, so forth. So at this point, at every single point throughout our CAN system, you see the arrows going up. We're trying to divert someone, right? So this is someone is not yet in our system, and we really don't want them to unless they absolutely have to. So we're trying to divert them, having those problem solving conversations, see, is there any type of alternative housing? Is there any resource that they can use? Anything that we can use to assist them with their crisis so that they do not have to enter our system. When they have the CAN assessment, at that time we had an assessment. We would conduct a VIs for that. However, we're kind of moving away from that to have more equity within our system, right? But the CAN assessment is done. At the time of the CAN assessment, the individual is either prioritized for shelter, added to a wait list, fortunately, or there may be a shelter bed available, right? But we are still trying to divert. And if they do enter the system, we are still working with them to try to help them with self-resolving. At this point, being that they are in the system, it will not be called diversion, but it will be called rapid exit. So continuing to work with that person to help to resolve their housing crisis, right? So at that point, if someone is in our system, they are then entered on a by name list. And a by name list is a list that has all individuals that are experiencing housing crisis, and they're on that list. So we can see who's out there, right? At the by name list, or when someone's on the by name list, our different CANs review that by name list. And at housing solutions meetings, that list is being reviewed to see if they can match someone to a housing subsidy, right? Based off of what their situation may look like, what their family composition may look like, what level of care they are either matched to rapid rehousing or permanent supportive housing or some other type of housing solution. Each CAN they have housing solutions meetings. However, there's tons of other meetings that each CAN has. But that is just a quick overview of what our homeless response system looks like. For the sake of this training, the important part is we want to divert. We want to divert at every single point throughout the process.
Okay, so when we're thinking of our coordinated assessments and we're thinking about, how we're going into these conversations, diversion conversations, we like to use the analogy of an emergency room of our homeless services. So when a patient or a person, a client in front of you comes into the emergency room, they're experiencing a housing crisis and they're looking for services that can help to resolve that crisis, that can, link them to housing resources, anything to kind of help resolve their homelessness in the community. So, that's the emergency room where we're identifying, what is really kind of going on and how can we help someone with housing. So as a patient is triaged in our coordinated assessment, that's where our assessment happens, where the conversation happens. When we're talking about what is your current housing crisis right now? What are the symptoms of your current housing crisis? Who are people that may be involved? What has led up to this crisis in this emergency room kind of visit? And from that conversation and from that detail that you're getting, you're looking to what could be the next possible kind of prescription or the resolution, to end this housing crisis, to end a person's emergency, in this space. And this is where you can use a multidisciplinary approach to treating and to releasing that person, from their homelessness or, from any analogy of an emergency room, from their emergency. So that can look at like, what are some of the recommendations once you're having that conversation, meeting or addressing person's needs and their concerns that led up to the housing crisis. What are some recommendations? What are some prescriptions that you can give in regards to, what are the next steps that can resolve that issue? How can we stop the bleeding in the emergency room? And sometimes that's providing, that next prescription or that next recommendation, and, what can we help? How can we help in that way? So as far as like the emergency rooms and treat, they want to get that person housed or get that person out of the emergency room as fast as possible. And the same thing goes, when we are dealing with a crisis, we want to resolve someone's emergency housing crisis in that moment if we can. And then that's where diversion can come in, where those conversations can be had about who can we connect with, what natural resources can we tap back into, what are some next steps that can really shorten and make your homelessness rare brief in one time. So we want to act with urgency and really kind of help that family or that individual by using diversion conversations and really getting them to see that these resources that we're using or that we're providing or recommending could really kind of help to resolve your housing crisis now, but also they can be some strategies that can be used in the future. So other than the cost of insurance to an emergency room, we think about also the cost to going into shelter as well, but also kind of like, the long lasting effects of, being homeless for a long period of time. So we really want to help to get people housed and get people out of their living crisis, whether it's in the community, place not meant for human habitation, but really kind of get them into a stable living situation so that they can continue to make progress in their housing.
All right, thank you, Bobby. So we're gonna go over the basics of shelter diversion. So shelter diversion is basically a strategy that prevents and ends homelessness. It prevents homelessness right at the front door of shelter. So the main goals of shelter diversion is really to help people identify immediate alternative housing arrangements. Also connect them with services and or financial assistance to help them secure and maintain their permanent housing. And then lastly, create a long-term housing plan so that whatever situation that they're in, their housing crisis, we don't want them to experience it again. So we want to create a housing plan so that they have a very clearly defined plan to follow so that they do not end up in the same type of housing crisis again. So as you saw on the diagram that we looked at for our homeless response system, you saw the arrows constantly going up to divert an individual. So every effort should be made to divert clients to other housing solutions after first contact with the homeless response system, right? Doesn't mean wait, but at every point, really, as soon as they call and they have some type of crisis, let's try to divert them. And we're going to go into more detail about what that diversion really looks like. But just based off of that quick overview of diversion, who do you all think should do shelter diversion? Feel free to either unmute or put it in the chat. Okay, yes, anyone, everyone, all of us, absolutely. Everyone should do shelter diversion. And there are some misconceptions about shelter diversion. Really, some people, I think because it has the word shelter in it, some seem to think it's only for shelter staff. Some seem to think it's only for 211 or only for diversion specialists, but really anyone can do shelter diversion. What shelter diversion is, it's a problem-solving conversation, which anyone can have. Of course, we work within the homeless response system, but there are other providers outside of our sector that still practice shelter diversion, because what it is a housing resolution, right? It is a housing solution, a problem-solving conversation. So we often have trainings and work with various providers, such as schools, child welfare, the criminal justice system, social service agencies, early childhood providers, hospitals, and various others, all working towards helping the individual in their housing crisis and really having that problem-solving conversation with them. So anyone and everyone can practice shelter diversion.
Thanks, Amber. Diversion is intensive service intervention. So we're trying to have a conversation with the client, hear from them, talk through the issue with them, the crisis, have sort of a wide-ranging discussion about possible solutions to each point in the lead up to the crisis that they're having. So through interactive problem-solving conversations with the client, which we'll get into more specifics about, staff should seek to understand what caused the person's housing crisis, explore immediate solutions. So even if they don't feel like, super long-term solutions, we're just trying to prevent housing right there. So that, long-term solutions are great, but making sure that they have a right now answer is the purpose of diversion. And then helping them pursue solutions. So giving them the tools that they need where possible to go out and operationalize those solutions. So yeah, the overall idea is to immediately get the client to a safe housing alternative, short or long term. So we will touch on this again a little bit throughout the rest of the presentation as well, but one of the things that CCEH does is train staff on how to recognize some of the trauma that comes with homelessness for clients. So homelessness and aspects of the homeless response system can feel traumatic to clients, and we want to reduce some of that trauma. So we now offer and continue to develop trainings on client-led problem-solving techniques. Some of you may have already heard of some of these. Some people may have already taken some of these trainings. Some of the highlights and most popular ones are motivational interviewing, trauma-informed care, strengths-based approach, and all of these are led by clients, playing into the resources that they already have. Oh, great, thank you, Malia. Good book on motivational interviewing. So yes, it can be studied independently. It can be, you can take it in a training. I definitely recommend doing a training that lets you practice. And then more trainings that we offer are around the sort of system foundations, the structural things that affect homelessness. So, making sure that we're paying attention to race, LGBTQ plus and disability equity. Those are just examples. There's certainly more. What are the particular issues that youth face when they're homeless? And what are the particular issues that people experiencing domestic violence face? And again, like those are just examples, but almost any facet of somebody's life experience can inform how they experience homelessness. So we're trying to include all topics relevant to staff and clients around best practices when we're diverting clients at the front door of shelter.
Thanks. So having the understanding of all of those skills that Catherine just went over is really important when it comes to having a diversion problem-solving conversation. We will be having additional trainings on those various topics in the near future. We usually kind of go over in full detail what each of them consist of, but for this training, we really wanted to spend a good amount of time talking about diversion and what that truly is. But please look for the training dates for those other trainings for motivational interviewing, about the different trauma-informed care, and those other topics. Dates will be coming out as I finish putting together our fall calendar, fall and winter calendar. So there are 6 steps that's really important when it comes to having a divergent problem-solving conversation, right? The first step is you want to introduce yourself and your purpose. Explain what the problem-solving conversation is and the purpose, why you're having this conversation and what your goal is. You want to have a very clear agenda. Step 2 is you're really going to start at this point having some reality testing. So you're going to reality test the option. So you're really listening to what the individual is saying, how they're describing their housing crisis, and seeing if there's any possible loopholes or anything that you need to get some type of clarifying information on. So you're doing some reality testing and starting to dig a little deeper. You're using your open-ended questions, you're rephrasing. That's where the motivational interviewing comes in. And then you're having a relaxed, open body position, and you're allowing time for the person to share their story, right? Active listening is you're present. So you are engaging, you're nodding your head, you're making some nonverbal, making some sounds so that they understand that you're listening, you're paying attention to them. Third step is strengths and supports exploration. Again, you're doing reality testing. You're seeing, are there any type of strengths that they possibly have, or maybe there's supports that they don't even realize. So you're asking those questions to gather additional information. We really are strengths-based. We believe in operating from that place of strengths-based. Everyone has a strength, even if they are not able to identify it. So you're focusing on the person's strength, their capabilities and their autonomy. And then you're validating what they have accomplished. Sometimes when people are in very stressful situations, they forget what it looked like when things were in a good spot, right? They forget how well they can be in certain areas. So you want to validate the accomplishments and the progress that they have made. You want the conversation to be as open and fluid as possible, natural, right? Someone doesn't want to feel as though they are being assessed or they're asked 50 questions back to back. So really listening to them as they're sharing their story and gathering that information. And then lastly, from having that conversation and really listening, you want to explore their housing and their employment history. See if what that history may look like, so you can see what options are available for them in the future. You want to see if they have any income or if they are receptive to earning income, such as maybe seeking employment, and then any potential support networks they may have. Fourth step is moving forward. Again, reality testing. So this is, you're putting that conversation together. You're starting to list and discuss possible outcomes. So you gathered all the information and now you want to see what options are there. Maybe as someone is sharing their story, they identify that they have a sister that they're very close to that, you know, has always been a support for them. So as an option, when you're having a diversion conversation, explore that. See if the sister may be an option for the person to stay with temporarily. See if the sister may be a resource for them and will be able to assist them in this housing crisis. So discuss possible options, right? There may be a variety of them. Discuss it, see what's out there. If it works, great, but if we don't present it and list it as an option, have that discussion, we will never know. And with this, you also want to set attainable goals, right? Very clear as far as what the next steps may be. The fifth step to having a diversion problem-solving conversation is really to create those connections. So this requires some mediation and problem solving in this step, where you're also summarizing the conversation that you had with the individual, and you want to make sure that everyone's on the same page. This is all person-centered, right? You don't want to create a plan for the person. You want the person to really create the plan for themselves with your assistance. So summarize the conversation, make sure you all are on the same page, and start developing their plan. Additionally, any supports that they have identified, maybe they have a service provider involved, maybe they have a sister that I referenced that may be an option for them to possibly stay with, reach out to those supports and have a plan with them. But you also want to identify other resources or make any additional referrals that can assist with the specific issues in the housing crisis that were discussed. Last step is to summarize and follow up, which is a very, very important part that many people leave out, because this is where you're really putting together some concrete action steps. So you're recording the action items. You're specifically saying who's responsible for doing what, right? If you're having a conversation and they are saying that they'll contact their sister to see if their sister is an option, you want to list that. If you as a service provider says, okay, great, you contact the sister and I will contact my reference with, my referral with a mental health provider, then you're going to list that because that's what you're going to do. You're the responsible person for doing that. And then you want to create timelines to go along with it. With any plan that is created together, you want to review and provide a copy to the person because it's a joint plan. It's their plan. They should have access to that plan. And if necessary, set a time to follow up. I'm going to do this next part, and then we're going to open it up just for some questions if you all have any. So some questions that you all may ask when you're having that problem solving conversation, when you're trying to gather as much information as you can and have a better understanding of their situation. You may ask if they can describe their housing crisis. What does that look like? If they have a place to stay, where did they sleep last night? And if they have a place to stay tonight. You're trying to get as much information to see what options are there for this person. You want to explore how long they've been staying at that previous residence or where they're currently staying. Get an understanding of their housing history by asking, when was the last time that their housing was stable? How long were they able to stay there? Then gathering information about their resources as well. But are there any other reasons why you can't stay there any longer? Do you think that your family, or if you had, do you think that you or your family could stay there again temporarily if we provide you with some help or referrals to find permanent housing or connect with other services? So what referrals can you all possibly make? What resources do they need? What resources do you have right now that can help you and your family find a place to stay temporarily or find permanent housing? Do you have any source of income? Have you ever called 211 in the past, or is this their very first time calling, or have they not even called yet? And something that people kind of forget about seems like a simple question, but do you have access to a phone? When we're telling people to call 211 or call this referral or call your family member, you need a phone to make these phone calls. So check in and see if do they have access to a phone. If no, well, that's a referral or a resource you all can make right there, because there are free phones out. And then also, do they have an email address? As you're having conversations, as referrals are put out, a lot of times an email address is necessary as a means for follow-up. So do they have an email address? If not, help them with creating one. So those are just some questions that you can ask someone to gather additional information and have a better understanding about their housing crisis and what that may look like.
Okay, so are there any other questions or any thoughts before we move forward? Okay, you can definitely feel free to put them in the chat as well. So this is a very also important piece of this presentation, but a very important piece of your conversation when you're talking with families and individuals, and when you're talking about their current living situations and doubled up situations, and having that active listening ear. And sometimes people, they may say it in between words that they may not be safe or may not be a safe living situation, but it's good to, also keep in mind some of these lists here of the sleeping arrangements, physical space, and behavioral health. So when it comes to our sleeping arrangements, and when you're talking with people and asking about what their current living situation is and how long that they've been staying there, it's important to get a really good, clear idea about, what the arrangements are, right? Are they, living in, someone's, spare room? Is there a safe and adequate place, for their children? Are they living, in a living room? Really getting an idea of the living situations, especially, for any population, but especially when it comes to children. Do they also have a safe place to stay? So those are, questions that you can also ask when talking to people, but also to kind of keep a active, open ear for that. So when it comes to physical space, thinking about and asking about that living arrangement that someone may be staying in, is there heat? Is there lights? Is there running water? Is there plumbing? are there any, is all of that, all those things, are they working? Are there any hazards, concerns for that particular individual or for the children? For someone who may have a physical disability, or if it's in the wintertime, heat, is heat available in that home? And sometimes it's a broader question of asking about, is that place meant for human habitation as well? Thinking about any problems with rodents and bugs and animals and any pests. Sometimes family members or individuals will say that to you, that, there may have been a rat infestation or there may be some bug infestations. And those are good information to actually capture, so that if it is a diversion, really, what are we diverting people to, their living situation? And, are there assistance programs that can maybe help with the infestation, to maybe help someone stay in their home, to really, create that safe environment? And do you have any concerns of, getting in and out of the home, referencing to safe places or restrictions? Is it, are there hazards to kind of getting, to the street? Are there kind of working steps? Is it, again, if someone does have a physical disability, are they able to, get from their home to the street, if there's no access? So those are information, it's good information to know, but thinking about this information that you're capturing, you're also sharing this information with your colleagues, who may be reading your HMIS notes, to know also the current living situation. But it also may be some conversation you can share with your colleagues, or when your strategy meetings, on different solutions that you can also offer to people, or, talking about, these concerns, and just making sure that we're diverting people to safe places. So when it comes to behavioral health, that, again, keeping that active ear when people are talking about, why they want to leave that place, or, why they can't stay there, or why they feel that it's unsafe. Sometimes it is a question of asking, or you may hear people say that there's some drug use or alcohol use or sale of it in the home, and there may be some concerns, with the children, being around that situation. So also making note of that, and, asking people if they're able to, find alternative housing, because that may not be a safe place or environment for the children. So can the parent decide who has access to their children? So sometimes that you can hear, that may be a concern if a mom or a dad is saying that they're sleeping in the living room, and maybe there may be a lot of people or visitors that are coming in and out. And it's really, a question, mom, do you feel safe? Or dad, do you feel safe? Are your children safe and secure? And sometimes that's a question to ask, but sometimes, again, you can hear that, from, the people that you're speaking with, about their concerns about how many people are maybe in and out of the home, and it may not be a safe situation. So is there anything that a person needs to do, or are there like any strings that are attached that makes that person feel uncomfortable? Again, sometimes people, you can ask, if you're staying with a family member, are you asked to do any favors in exchange for your stay? And sometimes, that, again, some people may say yes, right? Or some people may say no. And we hope that it's not that situation. But if someone does say yes, thinking about our trauma-informed questions and our trauma-informed conversation, where we may need to switch some of your line of questioning to maybe yes or no answers, because it could be a matter of safety. There may be some physical abuse or, verbal abuse that the client may not be outright saying to you, but if you notice that, some of their response, or it's a struggle to kind of get a full detail, from that person about, really what's going on and what's the situation in their home, and, and if it's safe, sometimes we can pick up on that negative situation or that hazardous or unsafe situation, and we may need to switch some of our line of questioning to be trauma informed. And sometimes that can lead to, some DV calls to Safe Connect, if that's the case as well. But just, again, kind of keeping in mind of, would this person, are they dealing with, physical and verbal abuse in exchange to stay, which can really be a real negative situation for families. So are people are they getting belittled or extreme sarcasm, being put down, having negative comments and that hurt your self-image. So, just being informed in that way and in your questions and in your conversations, because you don't want to divert someone who is in a, really hazardous and negative, unsafe situation. But it can also help to clarify if someone is able to stay there for a couple of days or even an extended stay, at that particular residence, what supports they would need and, if this is a long-term option for them. Okay, so we can go into examples of our housing crisis and hopefully some really good successful diversions, which I was able to kind of capture some of the, some of the stories and some of the experiences with doing CANS assessment, and hopefully these diversion strategies are also just as helpful to you. So for example, if someone calls in and the client or the person states that they're staying in their sister's home and they have to be out by the end of the week. So they called today, today's Wednesday, and they have to be out by the end of the week, let's say by Sunday, right? The sister's saying that they have to be out. And the client states that they currently do not have any income at this point and they don't have any other housing alternatives. So I guess I can also, I have a kind of diversion solution here on the side, but are there any other diversion solutions that you have that you would give to this particular client? You can put it in the chat. Okay, if not, that's okay. We're here for a training. So, all right, so the diversion solution, yes, other family members are available. Okay. So with this diversion solution, we wrote down, speaking with the sister and speaking with the family members. Amber mentioned, connecting with family members who have been natural supports in the past. And it's good to capture that information because you also help the person that you're speaking with identify strong supports in the community. There may be a family member who has in the past helped out with showers, helped out with transportation, helped out with food. And it's good to capture that and also, talk with the client about maybe those are resources that you could tap back into that can really be helpful because they might have been helpful in the past. Sometimes family members don't know, what else to do, or natural supports don't know what else are other ways that they can help this person in their housing crisis. But today they might know that they want that person to relocate. But sometimes it's really helpful to, once you had that conversation, your problem solving conversation with the person that you're speaking with or your client that's in front of you, and you have that shared agreement on goals and some steps, sometimes it's really helpful to share that plan with that natural support or with that sister. And with asking permission, if you could speak with your sister or with the sister, you can again share those goals and share the strategies that the client is going to take to obtain those goals. And again, keeping in mind that the sister or the natural support, they want to help, but do they know exactly where they can jump in? And sometimes this is an opportunity where that sibling may share some of their concerns, share, things that, they want to see happen. And that's an opportunity to take some of the goals that you've agreed upon, with your client and kind of pair that with some of the concerns of the family member and say, these are goals that, your sibling really wants to work on so that, they can maintain in the home or even for their own longevity in their own housing, and sharing those goals, with the sibling. And sometimes the sibling can jump in and say, okay, well, yeah, I can maybe help with transportation, and maybe I can help with, getting my brother to the American Job Center, or I can help getting him to job fairs. It can really be a really, collective conversation that you can have with someone who really wants to help, but they might not know exactly where else. And that's also really good, for that person that you're speaking with as well, because they know, again, they have an additional person on their team, not only from our homeless response system that's going to really try to help and solve or help this person in their housing crisis, but they have someone that they're comfortable with, someone that their family, their natural support that is also on board with helping with solving this housing crisis. So sometimes that can be really, really helpful. And you can, in that conversation, the sister can say, okay, well, if he's working on these goals, I'll let him stay, right? I'll let him stay for 3 weeks. And sometimes we can push a little bit and ask, well, if he's staying for 3 weeks, can you let this person stay for 30 days? And if they're really making progress, maybe they can, and they've increased their income, they can start contributing financially, and maybe we can extend, maybe to 90 days. And sometimes that's helpful when a family member or natural support knows that there's a plan, right? So sometimes it's really helpful to kind of get on the phone if you can, to talk with that natural support, or even kind of talking with that, some providers that may be there, and kind of sharing those goals and really having that collective approach. So when you're going to make your diversion note, you're securely saying, we've come up with a diversion strategy or a plan, a housing plan. The sister has agreed to let him stay as long as he's working on these goals, and she's actually let him stay, for maybe 90 days or 30 days maybe. So this person is diverted at this moment, and hopefully towards housing, right? The next transition can be towards housing, but it also providing different resources and next steps that the family member and the person can take, can really help to be a really strong diversion when you get that family involved. So that's a good housing solution. Any questions? Or has anybody tried that? Has anybody actually talked to family members and really had successful diversions with that strategy? Okay, well, maybe something to think about. All right, thank you, everyone.
So our second example of a successful diversion, whereas the last one had to do a lot with looking out for the client's natural supports. What do they already have going on that bolsters them? This example is of the diversion specialist being aware of resources. So the client states that he and his family have been staying in a hotel for the past month, but they have used up all their funds and they have to check out of the hotel by the end of the week, by Sunday. The client notes that they have identified a unit to rent. So that's a big positive, something to really make sure that we make the connection to at all costs. But because they've used up all their money on the hotel, they're not able to make the security deposit and first month's rent. So in that case, the diversion specialist, with their eyes on the prize of the apartment that's been identified, wants to target the issues of the short turnaround, which is Sunday, so not much time, a matter of less than a week, and making sure that we can put together the funds that we need to help the family qualify for the apartment. So a diversion specialist aware of the funding resources in their community can definitely tackle the second component. And one example that we give here is the homeful assistance, which is something that CCH can help coordinate, but of course there are other examples. So the diversion solution that we've identified that's positive is reaching out, coordinating the financial assistance as quickly as possible, supporting the family and getting their end of things together in terms of paperwork, and sticking to the timeline so that they don't have to have any gaps between the end of their hotel stay and starting in the new unit. So, I'll open it up to anybody who wants to add in the chat, or, speak up and say whether they've an example of a time that they've done something similar, called on the resources that they've been aware of in their community. totally fine either way. So yeah.
Yeah, and hopefully, these scenarios are ones that you can take back to your programs and kind of also talk through and have some strategy meetings or conversations around. So thank you, Catherine, for that other example. So here are examples of non-unsustainable diversions. And I would hope that I could get some feedback on this, or we can kind of maybe turn some of these into a little bit of a conversation. So the first example is that the client states that she's being discharged from the hospital on Tuesday of next week, and today's Wednesday, let's use that example, and that she will be homeless upon discharge. Client notes that prior to her hospitalization, she spent the last week sleeping on her friend's sofa. And since she has not been able to find her friend and doubts that she'll be able to return due to her friend having Section 8, that only allows a maximum of 2 weeks for visitors. Okay, so this is a note where I can see normally we might divert this person, right? Because they're not in immediate need of shelter, being that today is Wednesday, excuse me, and that they're being discharged from the hospital on Tuesday of next week. Can someone tell me why this is not a strong diversion? Or why you think this would be a diversion?
It's not a successful diversion because it's within 14 days of that cutoff. So it's a situation where hospital will discharge to homelessness, though there's no direct housing situation, housing plan in place. This comes up all the time. If there's a solution to this, please let me know.
Yeah. So yeah, when people are discharged, eventually, they will be discharged to homelessness if their diversion strategies that you use, aren't successful. And how you know that is that they will be calling 211 back and they will be calling you back, right? If those plans aren't successful. So I think it's also a conversation when it comes to hospitals, like how upstream can you work with your local hospitals about even using some of these diversion strategies and having some of these diversion conversations as well, and kind of sharing that with you, in your conversation, if you have that opportunity to speak with the social workers at the hospital before discharge. Sometimes that has been a strategy that I've used, that at least if there is a mental health or a follow-up appointment, that at least that person can have that appointment made. So before they discharge to the hospital, but you're absolutely right. It's not a strong diversion because someone will be eventually going back into homelessness upon discharge. Okay. All right. Any other kind of feedback on that? Thank you.
Just something else that wasn't pointed out was that she can't even get in touch with her friend.
Mm-hmm.
Right? So how stable can it be if she can't get in touch with her? So a concrete plan is not in place if you don't have the friend to actually confirm that she's able to stay with her.
Mm-hmm. Right. And at least if we were to put her on the shelter standby list, it gives you an opportunity to follow up. I think many, at least when I was in Cambria, on our shelter standby list, we would follow up with people 2 weeks after, and I know that may vary in different regions, but at least that person won't fall through the cracks. It gives an opportunity to follow up with them to see if some of the diversion conversations that you had with them and some of the strategies were successful. And if not, you can definitely kind of maybe follow up, and we can talk about kind of strong connections and warm connections in further slides downward, but at least also helps you, again, not to let that person fall through the cracks if you add them to the shelter standby list, knowing that they will be homeless upon discharge. Yes, Kelly.
Hi,
Hi.
if you have folks that are, that they're being evicted, and, so we encourage them to call 211, because it seems like everything, I think a lot of what I feel I'm struggling with, and a lot of people in our office, is the lack of availability. of stuff. So like folks that maybe are saying they don't have family or people in the area and they're at risk, they may not need homeless at the moment, but we know that it's inevitable if there's not a solution and we're not seeing one. So we're like, call 211. And a lot of times the CANS assessment, since that's really the first step, those are like a week out. So if you have people that are like, they come to us and it's kind of more immediate, like emergent, and they can't even be assessed or get on a list. Is there any recommendations for that? Because I know that there was a situation where somebody, I think, didn't even have an appointment until after the eviction was actually scheduled.
Hmm. Yeah, well, to get access to shelter, they have to have their CAN assessment. But I think this is where the helpful conversations come, where how we can broaden these conversations and who can we have diversion conversations with. So anyone can do diversions, right? So anyone in the community that has, contact, with a family or with an individual, and they see that this is coming, right? That there's some, homelessness may be abreast or someone may be at risk. We can maybe kind of jump in with, okay, there's a community action network that can maybe provide some case management in the meantime to maybe help, mediate between the landlord and the tenant, or, again, having increased access to resources in the community and the community knowing about each other's resources. How maybe can we, is there a program that can provide some assistance to help with paying, back rent, or really kind of help to mediate with the landlord, or really kind of help to maybe a family help increase their income in the meantime? How much upstream can we work to identify, what are the needs to hopefully avoid homelessness and get out of this crisis? But what can we do? What work can we do kind of upstream until that person can get to their CAN assessment? So I see as increasing access to resources as also training our partners in the community that may not be exactly in our homeless sector, but, are there, other, again, social workers that can also tap into some resources, and also connecting with those networks before their CAN assessment. Is there anything you wanted to add to that, Amber?
I'll just add, for that specific example that you gave where someone is being evicted and they actually have a date and they have paperwork, CANS do have resources such as prevention funds that can be used in that type of situation. So if it's confirmed this person have an eviction date, then that they're at higher risk and they need some type of assistance. So there are also prevention funds and assistance for those folks.
That's something you have to know to ask, like specifically for, you know what I mean? Like how do you?
I think when they're sharing their story about what their status is, it's important for them to say, I'm being evicted, I've been provided with eviction paperwork, I need to be out by such and such date.
And you said that those are prevention funds that are used?
There's different buckets, but there are assistance for prevention.
Thank you.
Would that scenario apply? Would that solution apply to a situation where a mother is staying with her son and the son wants her out, has not given a specific date, just wants her out as soon as possible?
For funds, or for?
Right, for the situation like if they're being evicted and they have a notice to quit and they've got that legal process moving forward, would the same thing apply to the situation that doesn't have a legal process? It's just the family member wants them out of the apartment or out of their place sooner rather than later, and it's just becoming more and more volatile according to the client.
I think for all of these, and this is why having that conversation is really important, because each one is kind of case by case. We need additional information. So you said son, it also depends on if it's a youth, right? If they are between the ages of 18 to 24, because it's different for youth versus an adult. So there are funds for a youth that is at risk. So it really depends on the family composition, the age, what their status was prior to this situation, if they have been unstably housed before, if they have a history of homelessness. There's so many different variations to that. So these kind of conversations and having that assessment is really important to gather all that information. So I can't give you a yes or no. There's so many other factors in that situation.
That I understood that. Thank you very much. I appreciate that.
Mhm. Okay, yeah, thank you for your questions. I appreciate the conversation. Okay, so with example number 2 of an unsustainable diversion, so the client states that they have been a shelter guest for the past 3 months, and yesterday they were given a discharge notice and advised they will be discharged within 2 weeks from shelter due to multiple violations. So the client currently has an income of $212, but Social Security disability net pending, I think, is $219 a month, and plans to sleep in his car until his Social Security is approved. The client has been diverted, not in immediate need of shelter. Can someone tell me why this is also not a sustainable diversion? Okay, well, we can put it in the chat. It's okay. So I got, oh, yep, okay. So we will cover some types of, oh yes, thank you, Amber. Okay, definitely there is a slide downward in this presentation that do cover diversion assistance. But just thinking about this particular diversion or unsustainable diversion, ultimately the person will still be discharged from shelter in 2 weeks, and they may not have any other plans. They don't have the income right now because they're still pending, and they tell you what their plan is, to sleep in a place not meant for human habitation. Although it's 2 weeks out, they're still going to be homeless. So maybe that would trigger, some outreach upon discharge, maybe connecting with that shelter case manager to talk or get an idea of some of the goals that that person has worked on, so that maybe we can pick up where they left off, or maybe there's again some community case management that the client can be referred to. But also, it may be a good idea if that person, when that person is discharged, that may trigger an outreach referral, for someone who will be literally homeless, so that they can also try to help with connecting to resources, but hopefully to get that person back on the shelter standby list for shelter. But ultimately, the goal is to help someone get housed. And the goal is not to go into shelter, but how proactive we can be proactive, because we have that inward network of another shelter provider that you can collaborate on resources. But ultimately that person may go homeless, but we would hope not to. Okay. Okay. So I would ask what the violations were that prompted the discharge. Absolutely, absolutely. And definitely, and if the person is working on some housing plan, like they're really close, maybe to getting some housing or being connected to a housing resource, also depending on their length of homelessness as well, could the shelter maybe give an exception, just for a little bit of time, because now they're working with, have additional staff or additional supports that can really kind of help this person stay on track and maybe hopefully get housed. So absolutely, asking about those violations, but in a way that can we work, now that that person has more supports, can this person stay a little longer? So really kind of working inward in our networks. Thank you. My apologies, that's my side too. Yes, okay, so moving forward. So again, after listening and talking with the person, about their current living situation, and really looking at, and having that shared agreement for one on those goals, that's really key to really kind of getting some movement on those strategies. And you don't want to tell someone again, what their goals are, but it's really to look at, and what can we agree that you can do? Because sometimes when people are in a crisis, sometimes they might not be able to see the exact steps that are in front of them. So it's our jobs to also, talk about what things that have worked before, and maybe some things that, haven't worked, and acknowledge those strengths. So when we're doing that active listening and talking about networks that people have used before, or places or people that they may have stayed before, it's really good to help them to see that there are things that they have done even before they contacted you in their housing crisis that they can do again. That's empowering to them and also motivating to people to highlight their strengths and things that they're good at, where in their mind, in their housing crisis, they may be thinking of all the things that they've done wrong to end up in that safety, to end up in that, that housing situation. So really kind of going back to living with friends, revisiting that conversation. Can you go and stay with family members that worked really well for you in the past? And that was really helpful. And those are really strong connections that you want to maintain. Returning to their own residence, is that an opportunity? Can they stay in their own residence? As long as it is safe, right? Is there some landlord mediation that may be able to kind of go on, or talking with landlord to kind of help someone, move back in or extend their stay for a little bit? So temporary diverted, as long as they are seeking housing. Again, that's, with those, with those family members, having all hands involved, those that really want to help, can they stay with you temporarily? Here are their goals. Here's the housing plan. And, can they stay in this housing because they're looking for their own housing, right? Ultimately, but they just need a little more assistance. And relocating to a safe and permanent place of their own. That's always the goal, and always keeping that in mind that, these may be steps, there may be steps to getting to your own apartment. Shared housing is one of those steps too, but, there may be, some steps to getting to your own housing, your housing, but what are some of the other needs that someone is also talking about, right? Of course, there's housing, but that there's other things. There's maybe employment, there may be transportation. Amber mentioned the phone. Do they have access to an email? It really kind of helps exercise that client voicing what their needs are in the mix of a crisis, because they may just say, I need housing, right? But also there are different things that can get to that point, and also helps them to practice voicing and explaining really what their needs are in between while they're working to get to house. Okay. So the stabilization plan. So I hope that many of you are familiar with the stabilization plan, that hopefully it's a helpful tool, for you in your problem solving conversations. It helps to, help people, remind them of what some of their goals were and what some of their action steps are. It's being housing focused, right? And really ultimately breaking down, again, some of those steps that we need to take to get to housing. Sometimes that may be increasing, your income, that may be, connecting with mental health supports, staying with a natural support or a friend, but really being because it's ultimately your goal, right? And some of these stops may be temporary, and there may be some temporary housing solutions with natural supports, but ultimately we want you to have your own space that you can call your own, and let's get there together if we can. So exploring the natural supports and resources, again, people that had helped you before, things that have been done before, like, sometimes having that conversation with people and saying, have you had this housing crisis before? And sometimes we can see that, right, in HMIS too. If someone has had experience in homeless before, you can ask them what worked the last time that you were experiencing a housing crisis. And that really is empowering, because again, that person can say, oh, well, I've tried this, maybe I can try this again. Or I have that friend that really helped me, with transportation. Maybe I can reach back out to that friend again. And it doesn't hurt to try those things that do work again, but, laying out those action steps of things that don't work so that you don't have to go through those again. So when it comes to, again, action steps and increasing your income, and again, sometimes being housed is a very broad, kind of, and can be an overwhelming kind of concept, because there's so many steps that are involved to get to that place. So the housing plan really can kind of help someone break it down by step, and they lead that plan. They lead those steps, and they say, this is what I can do in the next 2 weeks. And that's goals, that's strides, that person that can make. And to actually kind of write it down, sometimes that takes things out of your mind and put it on the paper. And sometimes that works as well. So what we talked about, what housing options have people already explored? So if they're already applied to different Section 8 or different housing authorities, or they've already, applied for this program, it's good to know that, right? And it's also good for them to know, so that when they're doing their planning, and again, they're looking at things that they've already tried, so they're not being redundant, and they can kind of hop into the next thing. having SMART goals, you know, and again, attainable goals that people can make and that they feel comfortable with. But, you know, we want them to, you know, resolve their housing crisis sooner than later, but, you know, attainable goals that they feel comfortable with doing. And that's empowering. That kind of gets the train moving, right? That hopefully it will have that momentum, that people just feel good that I can do this, right? Even though I'm in a housing crisis, but I can take these steps. And, you know, really what the housing plan is really geared to help people do. So when it comes to uploading the housing plan to HMIS, this is our way of sharing with our colleagues. These are some of the goals that, you know, we have agreed to work on. And we know sometimes when we're in a crisis, right, we may not be our best historians, right, of our own story. So sometimes we may need a little bit of reminding of, you know, resources that we've used before, or, you know, barriers that we've identified before. And HMIS is that sharing tool to really kind of help our colleagues revisit some of those goals, revisit some of those strategies, revisit some of those strengths. And the housing plan is also that tangible document or tangible paper that also can remind someone as well that these are things that you agreed to do, you know, and are you ready to take that next step? And it's always a reminder, and keep encouraging people as you go. It's just not a one-time conversation, but uploading this housing plan is extremely important so that when your colleague revisits HMIS or revisits, you know, this colleague and this client that may be experiencing homelessness in a totally different region, they have somewhere to kind of start versus starting from the basis. So it's really important to also share that information with your colleagues.
All right, sorry, I couldn't unmute. So we're gonna go into some scenarios. It's really important to have that practice work, right? And kind of talk a situation through, because it's very different when you're presented with a real life person and a real crisis. It's always important to practice to see how you can really help someone and navigate through that scenario. The examples of the diversion that is not sustainable that Bobby kind of went over, we see examples of those quite frequently, where people are marking someone as being diverted, but it's not a clear case of diversion. It's not a sustainable diversion, right? So we really think it's important to do some practice work so that we can practice on diverting someone. And of course, we want to divert as many people as possible, but there are some situations, as Bobby went over, that diversion may not be possible, and that person needs additional assistance, right? Don't try to force diversion if it's really not possible. If someone doesn't have a network, if someone truly doesn't have, or if they're really at the point where they are literally homeless, diversion is not necessarily going to work in those cases. They truly need emergency assistance. They truly need shelter. So we're going to go over some scenarios to really practice the different things that we've discussed. So in these scenarios, we want to identify the strengths that a person has. We want to make a list of some clarifying questions that you all may ask them to get additional information. As I said, we can't just answer yes or no in certain situations. We need additional information. Identify resources that you will provide them with or referrals you will make. Then we're going to talk about some possible interventions or case management that you will provide. And then lastly, develop some potential outcomes or plans for this person based on the information that they've shared. So of course, if this was an actual person, then we would incorporate client choice, but we're just going to play out this scenario of what we think may be some potential outcomes. So for the first scenario, and I'll pause for a moment and let you all review, and then I'll kind of go over it high level. have to make a note for myself, the different things that we are covering. All right. So scenario one, we have Stacy, who is in her mid-30s. She has a daughter that's 8 years old. She and her daughter lived with her mom for 3 years. Stacy's on a lease and pays rent. Her mom tossed her out after she relapsed 2 nights ago. Stacy has been clean in the past for 9 months. She has attended NA, but she stopped going to the meetings about 3 weeks ago. Her relapse only lasted a couple of days, but her mom could tell that she won't let her back in. Okay, and she won't let her back in, sorry. All right, so Stacy begun using her ex, who is her daughter's other parent, and she had several bouts of active use and recovery. The ex is remarried now and lives in the area, but is always too busy with the new family to spend time and energy with the daughter. All right, Stacy's daughter is still staying with her grandmother, and they're not allowing Stacy to see her. Stacy works hours, but they were cut due to COVID because she has been missing work. Stacy is angry with her mom. She's mad at herself. She's frustrated, but she doesn't want to start recovery all over again. Stacy hasn't had anywhere to go since her mom kicked her out and reports sleeping in the hallway of her mother's building. Okay, so Stacy has a lot going on, but where should we start as far as what are some strengths that Stacy has? And you all feel free to put it in the chat or just unmute and let's just have a conversation and go over these scenarios.
One of her strengths is that she's been sober for 3 years.
Right, yep, that is a big strength. For sake of time, I'm going to call some things out that I also see, and you all feel free to jump in as well. Some other strengths that I see Stacy having is, although she and her mom are not getting along right now, her mom is still there. Her mom and her grandmother are still there in their supports. They're taking care of her daughter, but they are very involved with her and they have been present.
I could chime in. This is Ada, and I could see that one of the strength is that she wants help.
Stacy wants help. She has received help in the past. She sought it before. Yes. Stacy has employment. Well, we think Stacy may have employment. Stacy has, she has been working. She has a history of employment. Okay. Any other strengths that were not identified?
She has the NA support system.
She has NA. Yep. Okay. And what things do we need to dig a little deeper in and ask some clarifying questions?
Income.
Income, right. What's the status with her job? I would also want to know, is Stacy on the lease? She's been living there for 3 years, but is she actually on the lease? I think clarifying questions, we need to know more about DCF involvement. Stacy thinks that they may have been called, but what has she done? Has she called? Has she explored? Has she asked to see if she truly has a case open? when is she going to talk to her boss to find out about her status of her job?
In the chat, we have, why did she stop going to NA? And what prompted the relapse?
Yep, all questions to gather more information, and I'm sure there are more. But we'll go to, so what are some resources or referrals that you all would possibly give Stacy? Good one, yeah. Outpatient counseling to process her relapse disappointment and what led her to relapse, because it's a cycle, right? She gets clean and then she relapses and then it happens again. So outpatient counseling to really work on that. Legal aid if she is in fact on the lease, right? Because mom can't just kick her out because she's actually on the lease. All right. And then we'll go to, what was the other part? Possible outcomes for Stacy. What type of plan can we create with Stacy to assist and try to divert her? Exactly. Can we pull mom into the conversation? Mom is mad, but that doesn't mean that mom will not be willing to assist. If Stacy possibly goes and receives that outpatient counseling, right? Maybe if Stacy goes to her NA meetings, maybe if Stacy talks to her boss or gets a new job and starts contributing to the home. So bring mom into the conversation to see if we can mediate that and if Stacy can possibly continue and get back into the home. All right, and then lastly, okay, also grandma is also likely trying to protect the 8-year-old daughter. Yes, doing some MI and digging deeper to see what does Stacy want her life to look like, right? Where does she want to be eventually? And what steps can we assist her with getting there? So there's so much, but this is just to kind of show the process and the thought process involved when you're trying to divert someone, when you're digging deeper. Lastly, as a case manager or a provider, what are some next steps that you all will do? So for sake of time, follow up with those connections. Yes, thank you, Maria. Create those connections with other agencies, follow up with those connections, assist her with those referrals that you all said as far as outpatient. DCF is another thing, thank you. So following up on those to see where do things truly lie and assist her with connecting to those references and I'm sorry, not references, but resources and referrals. So because we have this slotted to end at 3:30, we actually have some additional scenarios, but this will be sent out to you all. The slides will be sent out. So I encourage you all to go through those scenarios on your own, but we want to continue on with the presentation. So we're gonna go to our next section, which is resource mapping, which is really important with Diversion.
Mhm. Yes, so hopefully many of you are familiar with the 211ct.org website, where it really keeps a database of resources across the state for our homeless sector. But also it's very user friendly. You can type in your zip code, you can type in a keyword, and it will give you anything that's relevant, any organization that's relevant to that keyword. It will give a description program, a telephone number, the address, even their hours, right, that they're working when you're looking, for resources in your area. And sometimes it's really helpful to, when you're creating like a general resource sheet that you can kind of easily refer to, is transferring some of those resources maybe to a working document that you share with your organization. So it can also be kind of like a quick glance when you're having like just some common case management or community action networks. You have that kind of like at your fingertips to also give. But the wonderful thing that also happens is when you actually share this website with the community that you're serving, when you share it with your colleagues, when you share it with, libraries, local police stations, when you share it with anyone that's really wanting to, hopefully finding their seat at the table to really kind of connect people to resources. And the beauty comes in when next time when you speak with people, they say, hey, I use that website and I have this resource, and I talk to them, and this is what they need for you to do to collaborate, right? And then we can really kind of help house someone and get people to the next resource. So in that, you can find those resources and using that website. So hopefully you can share that, and that's a really useful tool for you. So sometimes when it comes to linking people, right, to these resources in the communities, sometimes you can really look at their homeless history in HMIS or even in the conversation, and knowing that there are times when people need warm transfers, when they may need that initial call, to be made for an appointment with their mental health provider or with their case management, transportation, and maybe even like, maybe some reminders, if you can, if you have them on a shelter standby list, sometimes that helps, for people to kind of get to those next stages. And again, it's something that you keep offering. Not everyone may be willing to see or be accepting, right, of the resources at that moment. But if you keep offering and having those housing resources in the end, it's really helpful to, really kind of connect people, warm to doing word transfers if they need it, if you see that there's really a barrier to connecting to those resources on their own. We can go to the next slide, please. Okay, so housing first, housing sustainability first. So it's really good, to have an idea of what your resources are in your community, but also building a rapport with those providers in the community as well. But yes, thank you. So it's really good to, when I say to build a rapport with people in those resources in your community, because you also want to keep up to date on what resources and programs are still open, right? You don't want to give someone a contact telephone number and then they call and that number doesn't work anymore, or that organization is not, present in the community anymore. That kind of chips away at the rapport that you may build with the client to trust the resources that you're also giving. But you also want to have that rapport of resources. So when you're referring someone to those programs, that provider knows, why that person is calling, right? So it's good to have those strong connections with food pantries, with local organizations, food closets, employment agencies, especially social services, drop-in center, basic needs, mental health, children programs, warming centers, substance abuse programs, and libraries, so that they have that network in the community. So resources, considerations, again, being housing focused, but not housing only, explore additional resource options and make referrals that are appropriate.
All right, and I know we're close to going over time, but you all asked about emergency assistance. I want to make sure that we definitely go over this part. So CCH offers a variety of different forms of emergency assistance, and it can be used, and I think we have a slide that goes over the different forms, but we have assistance for families, for individuals, for youth. And we can use the expenses for such things as security deposits, right? Rent subsidy, rental arrears, utility deposits, utility arrearage, Rental application fees, moving expenses, pet expenses is one type of emergency assistance that we recently added because we don't want pets to be a barrier to housing. So if there's additional fees that go along with a pet deposit, or if a pet needs to have behavior training or so forth in order for an individual to get housed, or even if a pet needs to be boarded so that an individual can go to a shelter or so they can begin their housing, then we'll do that because we don't want any barriers to housing. So additional expenses the funds can be used for transportation, childcare costs, just really thinking outside of the box. We do have some funds that are really flexible because we don't want any barriers to housing. And the slide is not here. However, if you have if your organization, if you have previously worked with CCH, in order to access our funds, you need to have an MOU. If you're not sure if your organization has an MOU, please contact me and I can let you know. So you would need an MOU, and you would need access to HMIS and have attended some previous type of Diversion training in order for you to have access. So we have the Homeful funds that we referenced earlier, that's for families. We have YHDP, Shelter Diversion Rapid Exit funds, that's for youth between the ages of 18 to 24. So if they are at risk of being homeless, as well as youth that are actually literally homeless. We can use funds to assist them with changing their status so that they can be housed. And then we have flexible funds for individuals as well for diversion or rapid exit. Very rarely do we have funds for each population, but we do. And we understand that emergency assistance is huge and really comes into play when it is, when we're trying to divert someone, right? When someone needs that additional assistance so that they can get housed. So we understand that we want to divert someone at all times. We want to divert, we don't want anyone to enter our system, but we also understand that diversion is not possible at times. So when diversion is not possible, one of the first things is, if you are in the system and you're doing paperwork, do not mark that person as diverted. In session 2, as a follow-up to this training, we're going to go into more detail as far as the outcomes, but don't mark that person as diverted because they weren't diverted. So don't mark them as being diverted. Also, connect them to CAN outreach, right? If it's someone that's unsheltered, they should be connected to an outreach worker. If you're working with someone and they're not able to be diverted based off of what their situation is, you can add them to a priority wait list or check for available shelter beds. Also, as Bobby talked about, having that client contact information is really important as far as follow through. So using any type of technology that's easiest for them, whether it's text or email, and providing them with some type of your contact information, but also getting any information as far as any national supports they have, any service providers that are working with them. And as I just said, making sure that they have your contact information, they have a way to get in touch with you, whether it's email, whether it's text, if you have drop-in hours. We don't want a client to feel as though nothing happened, right? There was no plan that was in place. They don't know the next steps. They didn't feel as though they were assisted at all, and that they need to call 211 again. So we want to avoid that, provide them with as much information as you can up front. So I'm sorry that we had to quickly go through the second part of this training, but we will be having additional ones to follow. We will be having a part 2 that we're going to go into more detail with the documentation, with the outcomes, with writing good case notes and what that really looks like, the full workflow in HMIS. But if you all have any questions or any follow up information. Our contact information is on the screen, so please feel free to email us. If you have any additional questions or training needs, maybe you want some additional training for your organization, you can contact training@cch.org, or you can just contact me because it will come back to me anyways. But I'm going to open it up for if you all have any additional questions or things that you want to talk through. We can kind of stay on for anyone that does. If anyone has to go, being that we're after 3:30, thank you so much for joining. The slides and this recording will be available. We will, I'll put it on our website by the end of this week. If you go to our website, www.cch.org, you can go to our webinar library and it will be listed there. So thank you for joining for those that have to hop off at 3:30. Any questions?
So Amber, I've got a question for you, and it's kind of tied to the question I've got in the chat box, which says, what is the limits on the rent subsidies? Several clients are working as many hours as they can. Some of them 35 to 40 hours a week at a rate that is almost, minimum wage, and they don't have enough income to support an apartment these days. So for the subsidy that you mentioned, how does that subsidy work, and how long will it extend?
Okay, subsidy, I'm sorry, I forgot at which point I mentioned it. Subsidy as far as Diversion Rapid Exit.
Well, it was on one of the more recent slides. There was a list of funding available, different types of funding available.
Okay, so for a subsidy, there's rapid rehousing that an individual, there's various. So it's based off of a person's situation. There's some prevention funds that can be used, or a subsidy that based off of what it is can be used for up to 12 months. Rapid rehousing is a short-term rental subsidy, which the goal is 6 months, but it can be extended based off of someone's needs. There's permanent supportive housing that if an individual meets the definition of chronic homelessness, or they have a severe mental health or substance abuse diagnosis, they can have housing indefinitely as long as they are in compliance. And then for diversion rapid exit funds, based off of what funding source it is, for some diversion, being that it's to change a person's situation, it can be used for a one-time or short-term assistance. So very short-term to assist a person with not having to enter homelessness. So security deposits or rental arrearage or first month's rent, just to change their situation, not an ongoing thing, is for diversion or rapid exit funds.
Okay, a quick follow-up question, and this is going to be a totally unfair question, so I apologize in advance. I don't suppose you have a kind of like a cheat sheet that could tell us what the type of housing is, like you mentioned, the rapid exit, the permanent supportive housing, the subsidy, and the source for that funding, or the path to get to the funding, because in my particular role as a homeless diversion, these avenues to get to that funding I'm not aware of.
So for someone to access rapid housing or permanent supportive housing, you have to go through the system. So that homeless response system, that flow, they will have to have the CAN assessment, be entered on a by name list, and then match to a subsidy. So it's not just a funding source for rapid rehousing or permanent supportive housing. I have another training, and Joshua, I can actually send you information on that, or we can follow up and I can have some additional information for you.
That would be great. I appreciate it. Thank you.
Any other questions? All right. Well, thank you all so much for joining us. Please look out for follow-up trainings on shelter diversion as well as other various topics. You can also look at our training calendar that is on our website as well. Thank you for joining us, and you all have a great day. Thanks.